So my group is presenting cirrhosis, and I will start off by presenting etiology. So the cause of cirrhosis, the main cause would be chronic alcoholism. It can take up to years or decades, depending on the patient. Another cause can be genetics. Another is bile duct disease, NASH, chronic virus hepatitis C, and hepatitis B. The epidemiology of cirrhosis, and as of 2015, 2.8 million people were affected by cirrhosis. Of the 2.8 million, 1.3 million did die from the cause. Alcohol did count for 348,000 cases. Hepatitis C accounted for 326,000. Hepatitis B accounted for 371,000. And cirrhosis is common among males.
My name is Cheyenne, and I will be presenting the signs and symptoms of cirrhosis. So some easily noticeable signs of a patient with cirrhosis would be easy bruising of the skin, the swollen ankles and lower extremities, weight loss. There's also going to be lots of yellowing of the skin, and especially in the whites of the eyes. The abdomen is also going to be really swollen and tender to the touch. And there'll also be visible spider-like veins, and the veins are just going to be a lot more dark and more prominent in the skin. Some symptoms a patient may present would be fatigue, loss of appetite, nausea, and then there's also going to be lots of itchy skin due to the yellowing. There's also going to be some memory loss that comes with it. For the chief complaint, a patient might go into the doctor and have the most common complaints would be the bruising, the yellowing of the skin, more noticeably in the eyes. There's also going to be lots of weakness. There's going to be easy bleeding, and again, that more tender touch of the abdominal area.
My name is Rosie, and I did physical examination. Upon examination, if there is distension of the abdomen, bulging flanks, elicitation of a puddle sign, and shifting dullness, it is suggested that the patient has ascites. The patient may present with asterixis, inability to sustain posture, feature hepaticus, chronic distinct odor to breath, which usually smells like sulfur. For differential diagnosis, conditions to consider are ascites, varices Budd-Chiari syndrome, intracranial lesions, infections, metabolic encephalopathy, hyperammonemia from other causes, and toxic encephalopathy due to alcohol.
My name is Norma, and I did the workup section of it. A physician will have the patient complete a couple of tests to diagnose cirrhosis. Some are lab testing, which include complete blood work, complete blood count, liver function tests for enzymes, viral hepatitis serologies will be some of the testing they would do. Imaging testing might be also ordered, such as ultrasound, CT, or an MRI. Sometimes biopsy is necessary, but usually it's not. But that doctor might want to order it to determine how severe the cirrhosis is. For a treatment plan, it would depend on the cause and how severe it is, and how severe the liver is, the damage to the liver is. The liver damage to cirrhosis cannot be reversed, but further damage can be prevented. Stopping consumption of alcohol, especially if cirrhosis is due to alcohol abuse. Change in lifestyle, such as controlling blood sugar levels, a healthy plant-based diet, losing weight, and exercising. Some medication is also used for treatment. And in very severe cases, treatment would be a liver transplant.
My name is Brandon. For the prognosis of cirrhosis, since cirrhosis cannot be cured, the patient can still be treated and continue to avoid certain risk factors that may cause the disease to flare back up. Most patients will continue to be asymptomatic for many years following. However, 5 to 7% of persons with cirrhosis will observe symptoms such as jaundice, ascites, and hepatic encephalopathy. Treatment is also available in the case that it returns. Patients can avoid risk factors such as drinking alcohol, smoking, and also improving their diet or physical well-being. With treatment and lifestyle changes combined, patient will most likely not encounter the disease again. Okay, is that good? We're all good?
We did it. Yeah.
Yeah, we did it.
You're gonna see me get scared. My dog barked again and I jumped a little bit.
All right, let's stop this.
I think we did good.
Yeah, I think we did really good. I don't think
Yeah.
anybody hiccuped, right? I didn't. The only thing is I didn't introduce myself, but
He knows you. It's okay.
yeah.
It's okay. All right.
I think that's kind of okay.
All right, perfect. We'll stop the recording.